For generations, men have heard whispers about a mysterious area said to hold the key to deeper female pleasure. Some believe it is a hidden anatomical structure. Others think it is simply a myth created by modern culture. And many men quietly worry that if they do not understand it, they may be unable to fully satisfy their partner. The topic of the so-called G-spot has been surrounded by fascination, debate, and confusion for decades. Yet behind the mystery lies a far more nuanced medical reality, one that involves anatomy, psychology, communication, and the evolving nature of intimacy. Before we explore this subject together, take a moment right now to hit the like button. Comment below where you are watching from. And subscribe so you never miss medically grounded insights that can help you build confidence, connection, and long-term sexual well-being. Hello, gentlemen. I'm Dr. Hannah Cole. For more than 20 years, I have worked with couples and individual patients seeking clarity about sexual function, emotional intimacy, hormonal transitions, and the physiological changes that naturally occur as relationships mature. One of the first things to understand about the G-spot discussion is that human anatomy rarely conforms to simple labels. Research suggests that rather than being a distinct button, this sensitive region may represent a complex interaction between the vaginal wall, surrounding nerve networks, and underlying erectile tissues connected to the clitoral structure. In other words, pleasure often arises from a coordinated response rather than a single isolated point. This insight changes how men might approach intimacy. Instead of searching for a precise location with mechanical focus, many couples benefit from exploring rhythm, pressure variation, and emotional presence. Sensitivity patterns can differ significantly from one individual to another, influenced by hormonal state, comfort level, and prior experiences. Psychological readiness plays a crucial role. When a partner feels relaxed and emotionally secure, the nervous system shifts toward a parasympathetic state that supports arousal. Blood flow increases, lubrication improves, and sensitivity becomes more pronounced. In contrast, anxiety or distraction may reduce responsiveness regardless of physical technique. Communication therefore becomes one of the most powerful tools for discovery. Open dialogue allows partners to share feedback without embarrassment, transforming intimacy into a collaborative experience rather than a performance challenge. This process often deepens trust, which in turn enhances physiological response. Age and hormonal transitions can also influence perception. As estrogen levels fluctuate over time, tissue elasticity and lubrication patterns may change. Gentle pacing and attentiveness become increasingly important in maintaining comfort and enjoyment. Men who adapt to these shifts often find that emotional connection gains greater significance than specific anatomical targets. It is equally important to consider cultural expectations. Media portrayals frequently present simplified narratives suggesting that mastering a particular technique guarantees satisfaction. In clinical reality, fulfillment depends on multiple variables, including relationship quality, overall health, and stress levels. Men sometimes internalize unrealistic pressure to deliver consistent outcomes. This pressure can activate performance anxiety, interfering with natural erection signaling. By shifting focus from achievement to shared exploration, many men experience improved confidence and more stable arousal patterns. Physical health factors should not be overlooked. Cardiovascular fitness supports sustained blood flow to the pelvic region for both partners. Balanced nutrition and adequate sleep contribute to hormonal harmony, which influences libido and responsiveness. When the body is well supported, intimacy often becomes more fluid and less goal-oriented. Another dimension involves sensory awareness. Subtle changes in breathing, muscle relaxation, and touch sensitivity can guide partners toward mutually satisfying experiences. Developing this awareness requires patience rather than urgency. For some couples, external clitoral stimulation combined with internal pressure variation may create heightened sensations. For others, emotional closeness and slower pacing prove more meaningful. There is no universal formula. Understanding this diversity can relieve men of the burden of comparison. Instead of measuring success against myths or pure anecdotes, they can focus on cultivating presence and attentiveness. Over time, this approach tends to strengthen both sexual satisfaction and relationship stability. Ultimately, the question, does the G-spot really exist, may be less important than the broader insight it invites. Human intimacy is multidimensional. Pleasure emerges from the interaction of body, mind, and connection. When men embrace this complexity, they often discover that confidence grows naturally. Intimacy becomes less about technique and more about shared experience, a shift that supports long-term emotional and physical well-being. If today's discussion has helped you view this topic with greater clarity and balance, make sure you subscribe for more medically grounded conversations about erectile strength, prostate resilience, hormonal health, and confident aging. And if you want to learn about the subtle circulation habits that can improve performance endurance and erection firmness over time, watch the next video appearing on your screen now. Small lifestyle changes today can make a meaningful difference in how you feel years from now.